We're also about to hear the experience of a person whose problem has changed. I am Dr. Anumod Kakkassery MD Ayurveda. In men, blood circulation will usually be fine, but the testosterone hormone tends to decrease. In Ayurveda, as we know, there are many medicines, and in Rasayana Vajikarana treatments, a lot is said about increasing testosterone hormone. When taking such medicines, it is possible to increase this male hormone level quite quickly.
Earlier, we used to have the desire to have intercourse daily, even every day if we wanted. After turning 48, now I am 51. After 48, that frequency now, well, it became once every 3 days. Then it became once every 4 days. Then in a week, approximately, maybe once. Then, when you say taking medicine, for that, I too have tried taking a pill like that once. So, when you take it, well, it's okay for a while. But after that, it wears off. But when I took it for a month, for about 5 months, I was doing well. Then,
nowadays, one major issue men face is this so-called pause, or what is referred to as andropause. In this episode, what we are discussing is there are 3 reasons that cause andropause, or in other words, what leads to a decrease in male sexual vitality. So in this episode, we are going to discuss what these 3 causes are and what the treatments for them are. Similarly, we are also going to hear the experience of a person who came here for treatment and overcame erection problems. I am Dr. Anumod Kakkassery MD Ayurveda, Thrissur. Nowadays, as we know, this so-called ejection problem or problems with erection are referred to as erectile dysfunction disorder. One of the main reasons for this, erectile dysfunction, or what we call reduced erection capability, is a major issue. Very often it leads many family relationships towards a breakdown. Often the wife thinks that her husband is no longer interested in her at all. For husbands, very often their sexual capacity to engage in intercourse is not as strong as it was in their younger days. All of this leads to major problems and causes mental stress. We are left wondering why this is happening. The first reason that comes to my mind is the decrease in blood flow that occurs in men, especially after the age of 40. We often say that the penis is an organ that requires a lot of blood circulation. Very often, there comes a time when blood flow decreases significantly. That is, when the tissues in the body become weak and muscle strength decreases, blood flow also reduces, and as a result, erections decrease. This is an important point. The second point to mention is the issues and deficiencies that occur in the testosterone hormone. As people age, it is not necessary that they will have the same level of testosterone hormone as they did in their youth. So the decrease in its level also becomes an important reason for this. Similarly, another reason is anxiety disorder. When someone fails once or twice, they experience significant psychological conflict. See, another problem that arises next is the anxiety about whether they will be able to perform the next time. This anxiety problem leads them towards erectile dysfunction. So when we identify these 3 reasons, what happens in such individuals is that for some people, their testosterone levels and hormone levels might be perfectly fine, but the problem could be with circulation. So in these individuals, when we improve just the circulation, we can see that their erectile dysfunction gets resolved. In some individuals, blood circulation might be perfectly fine, but their testosterone hormone levels may be low. In Ayurveda, as we know, there are many medicines. And in Rasayana Vajikarana treatments, a lot is said about increasing testosterone hormone levels. When taking such medicines, it is often possible to quickly increase this male hormone level. Some people may also be experiencing anxiety. So when we give them medicines to reduce anxiety, we can overcome this condition as well. However, in many cases, some individuals may experience anxiety, circulatory problems, or low testosterone hormone levels all at once. Often, when 2 or sometimes even 3 causes occur together, we can address the issue by giving medicines tailored to those specific reasons. In my opinion, when compared with other sciences, the greatest advantage of Ayurveda is that since it uses purely herbal medicines, there are no side effects or other problems. And after using it for a short period, the benefits last for a long time. While many other tablets only provide relief for about 2 hours, with Ayurvedic medicines, since they correct the body's system itself, we can see that their benefits last for months. At this point, let's listen to the experience of someone who came here for treatment in this area and has recovered.
when you first came here, didn't you mention a problem with digestion? What exactly was that? That is, after about 44 or 45 years of age, I started having issues like blood pressure and diabetes. So at first, as I mentioned, we had, a way to get in touch daily if needed. After 48, now I am past 51. After 48, it became like, every 3 days. Then it became every 4 days. Then it reached a point where I wondered if once a week would be enough.
That's quite a long time.
Then I started drinking plenty of water and managing things like that. So then I thought, now I'm getting older, right? That's what I was thinking. Even after 48, I started having these kinds of feelings. And then my wife too, now she is 45 years old, so she doesn't insist much either. Yeah, so if we want, that's enough. Otherwise, it's okay if we don't. So we didn't make it a big issue. I didn't make it an issue either. So that's how things were going on. Then one day when I came here, when we talked like this, when I came to quit and told about my problem, I was given medicine, and the effect of that medicine was incredible. I have been taking it for a month now. After taking it, I saw a really good change. That is, it was a state of weakness. So things weren't working out. But now, after taking this for a month, it's been about 4 or 5 months, and I've seen a really good change. When I say a good change, that strength started coming back and things are working out now.
I've taken English medicine before. What exactly is the difference between that and this?
When I say I took English medicine, I mean that once I had taken a tablet like that, and while taking it, things would be okay for a while, but after that, it would wear off. But when I took this for a month, I felt good for about 5 months. After that, what can I say? Even though I'm not like I used to be, my condition has improved. Now, if I feel like I need to take it for a month, I take the herbal decoction occasionally. Taking the decoction is good, isn't it?
What we did, as we mentioned that day, was to treat it in two ways. One is that reduced blood flow to this area causes our erection problems. So the main approach was to use a decoction that increases blood flow, which significantly improved blood circulation. Plus, in Ayurveda, there are medicines that increase testosterone, the male hormone, and those are present in the tablets as well. When both of these were combined, it led to a proper course of treatment. One important thing about this is that as we age, both male hormones and blood circulation decrease. These are the two main reasons, and another reason for this is anxiety, which is common for many people, especially at the beginning of marriage. Due to the tension about whether things will work out, erection may not happen, or there may be a lack of strength and fear sets in. So to put it simply, there are three reasons. If we understand the cause among these three and treat accordingly, honestly, this is a condition that can be treated very easily. Okay, thank you. So just as we discussed here in this particular person, the issue was due to a problem with circulation and a disturbance in hormone levels. Once both of these were addressed, we were able to overcome this problem. We'll see you again in another episode. Thank you.